confident that it's not a disc issue is because you're not presenting like that.
Mm-hmm.
I did, as you maybe you can tell, I don't know. I probably did about 30 tests on you. I mean, everything from bending down, touching your toes, going this way, lifting your leg, turning the leg this way, turning the leg that way, putting the leg this way, lift one leg, lift the other leg. Like all these hip tests, pushing in, pulling down, messing around with all this hip and pelvis. I probably did like 25, 30 tests. So basically, most of them were centered around this area. Right, seeing if you have lack of pelvic mobility, which is really not too bad for you actually. Lack of range of motion in the hips, not too bad of you. The only thing that really stood up as like a low hanging fruit thing was like the scoliosis thing, and the fact that you feel a little bit of radiation of symptoms like out to like this region, and I'm just gonna circle it broadly. With any of that disc pain, we can often see nerve pain that goes down, which is what I was talking to you about with that. I showed you when you were laid on your back and I went like those weird tests and you're like, hey, I just feel like normal stretching. I was really just testing to see if I can pull down the nerves and like really create some irritation. We call that neural tension signs. You didn't have any of them on either side. You didn't have any compression on the other side. But why would bench press hurt you? When somebody has a disc compression, you definitely think that like, what's it called, intra-abdominal pressure, like bearing down like that would cause some pain, and so that's my first thought. But it seems like that's not an issue for you. So I think really the biggest issue was the scoliosis that's causing some maybe irritation to the nerve routes around that area. Your peak of your curve is anywhere between T11 and L1. T11, T12, L1. Which, to give you context, here's 5, 4, 3, 2, 1, 12. Right? Out of that area, if we add the nerves, we tend to see these cluneal nerves sometimes that come off of those areas and sometimes give route to that direction. If you treat the cluneal nerves like it's a disc herniation or disc bulge, they don't really resolve that way. You really kind of have to be very targeted towards that T12, 11, and 1. I also just think you might have some myofascial pain from the scoliosis. Now, let's be clear on scoliosis, and we can talk about that for a second. Like, a lot of people will say, do I have scoliosis? It's messing me up. Some people it is, some people it isn't, right?
Yeah.
I have some scoliosis, like at, I think it's T11, and there's like one or two segments that are kind of like weird looking, and so if you kind of took me off, you'd see like the other side, like one side's a little bit more firmer in my abdominals. It's because of the curvature on the backside, right? So it's really like I don't feel it, and sometimes you may not feel it, but just you're feeling it now. The good news is likely not going to progress because you're done growing. So I'm sure you've had that conversation with some of your doctors too. So for that reason, I actually find that like with cluneal nerves, or maybe, and I don't want to say cluneal nerve impingement because impingement sounds like it's getting choked off. I think maybe just that excessive curvature going that way is causing a little bit of biomechanical dysfunction that's kind of locked up, like you're kind of like locked up on this side, and now all the muscles over there are kind of just working harder, and maybe they're getting pinched off in there. You didn't have, there's only like one or two tests really for cluneal nerves, and it's not like a real test. I hate to say that. I don't want to say it's not a real test. It's not like a true orthopedic test, but it's like a test that I learned through this random low back pain course. And it was really cool. It actually works.
Okay.
Sometimes. And so what I find is just a lot of people will get that referral pain, not to the front of the hip, but it's like more towards like here. It feels like most people do this. Like, and it's not like back here as much, it's more here. I don't know if that sounds familiar to you.
Does a little bit, yeah.
So I think it has to do with the superior, middle, and inferior cluneal nerves. Probably more the superior because that's the higher one, which means more likely that curve up there. So I think in terms of adjustments, like we can do some adjustments on you. I think we should do some myofascial work up there. We'll just kind of have to retest you and see what works and what doesn't. Any questions on that?
Not really. I mean, the it looks like what the path of the cleaners follow is. I do get some pain, like down my hip, a little bit in here, but not always, and it's not really like.
They typically don't go
bulk of the
past
pain.
like right here
Yeah.
either, ever. And I tested you neurologically through L4, L5, S1, S2, S3, and you had zero. And like it's not like you're having loss of strength. You're having, in my opinion, loss of strength due to inactivity, not loss of strength neurologically.
No, that's true. Yeah.
So and you're one of those people that, and I kind of want to say congratulations, you fall in the statistic, that have some sort of disc bulge but are not presenting that way. And so you can kind of see now medically, as you enter medical school and the medical paradigm, that how like one doctor can misinterpret that bulge as the true source of pain.
Right.
Pain does not mean you have an issue, and the lack of pain doesn't mean you don't have an issue either, right? It's like just and this is not to take this out of context, like you can get a viral infection and have a positive immune response and have zero symptoms, and that is I used to make that analogy way before COVID happened, but that anyway.
That works out.
Yeah, it just works out now. So now people can see that. So you and I can have the same, let's just say bacterial infection, and you might present as like having some sort of like cold and head cold, and I might present as like completely normal.
Yeah.
Or vice versa. Or we both might present the same way, right? So I think in your case, we should just look into that and kind of keep this in mind and kind of attack it as is. I find that extension stuff doesn't work on that at all. If you want to go ahead and do it, that's fine. I think we just got to find ways to freaking calm this down. I don't know how yet, but we'll figure that out along the route. Any questions on that?
Nope.
All right. So